changing, and not so rapidly as it did in the past, but still a lot of work is going on. Um, so I'll just, Dr. Ayaz Samadani, and so we will start with the program number 21, March 24th. And let me get to the slide. Confirmed COVID-19 cases, according to CDC, US over 30 million, and about 500,000 or above 500,000 deaths. So that has increased, but not as much. If you recall, we had up to 5,000 new cases a day. Now it is about 1,000. And worldwide, we had 125 million cases and over nearly 3 million deaths. Wisconsin had above 500,000 cases and 7,000 deaths. And Columbia County had 5,424 cases with 62 deaths. All groups now currently eligible for COVID-19 vaccine include, this hasn't changed from the previous grouping, which was A1, A, B, and A, C. But now we are in the middle of the phase of vaccination. Frontline healthcare personnel, physician, nurses, nurse practitioners, residents, and staff at the skilled nursing home and assisted living facilities, police and fire personnel, correctional staff, especially when the prisons had very high rate of infection due to close proximity, adults age 65 and older, educators, childcare staff, individuals who are enrolled in Medicaid long-term care programs with disabilities or other health problems, and some public facing essential workers. So when the vaccination will be available to all, it appears that by May, end of May 2021, every resident of Wisconsin age 16 and older will be eligible for the vaccine. They haven't checked the vaccine trials for the children, so the study is going on, and they have enrolled younger age group, and soon we will have recommendation by CDC. And I'll tell you towards the end, I just included a slide on children, why they don't receive the vaccination. And this is from Krispy Kreme donuts. If you get your shot, the vaccine, and Crispy Donuts, they said that they will give one donut free every day. So just take your certificate and show it to them, and they'll give you a donut. I don't know if you'll get a little heavier or plumper after that, but if you fancy that, I think they have inciting people to receive the vaccine, and this is a plus. CDC updated quarantine recommendations, and a couple of weeks ago, they have recommended, they haven't changed that stance on that. People who have tested positive for COVID-19 within the past 3 months or have been fully vaccinated within the past 3 months, and they do not have any symptoms. So those are the people who do not have to quarantine and or get tested again. And there was also a recommendation, if you meet in a gathering, all those people who are asymptomatic and belong to this category, they have either antibodies, natural through the infection or by injection, so that they can meet together. They haven't defined the grouping, that whether it's a small group, medium group, or a large group. They said one household, and then the other time the recommendation came when you have another visitor from other than one household. So, so be careful, but still, if you're in doubt and somebody has symptoms, and you take social distancing. If symptoms of COVID, disregard the history of prior COVID-19 positive antibody test or vaccination. So test and quarantine pending results of test. And quarantine is 14 days, but if the symptoms disappear, then it's 10 days or 7 days. So if somebody had symptoms, it's 14 days. If somebody doesn't have symptom, it could be reduced to 7 days. So, and this is a little information on Pfizer and other Moderna, as well as Johnson and Johnson. This is nothing new, and Pfizer made this mRNA vaccine, which is genetic, DNA. There are 2 shots, and they're 3 weeks apart. And shot is given in the upper arm outside, and it does not contain egg products or preservative or latex. So there is no question of allergies. The people who have allergies, they can get a reaction, and those are milder with their redness and pain, and they may or may not have fever. And this is on Moderna, and this is also second type of mRNA, still 2 shots, and they're 28 days apart, and shots are in the muscle of the upper arm, and this does not contain eggs products or preservative or latex. So they're more or less same, if you by description and by mechanism of preparation and mechanism of action is the same way. And this is on Johnson and Johnson, Janssen COVID-19 vaccine. Manufacturers are Johnson and J&J company, and it's a viral vector, which means it's a modified virus. It's a 1 shot, and shot is given in the muscle of the upper arm. This also does not contain eggs products or preservative or latex. And so these are the 3 main vaccines available here. In other countries, there is a Sputnik, which is a vector vaccine, like Johnson and Johnson, is made in by Russian company. And they said their efficiency is above 90 to 96%. And so it's pretty same. This is a New York Times article, which was came out as AstraZeneca vaccine was available, then it was on hold, and in few countries it was stopped and then restarted. So the FDA went a little bit deeper into it, and they think that vaccine may have been based on outdated or incomplete information about the vaccine effectiveness. So this is an extraordinary blow to the credibility of this vaccine. And they also, in their independent panel of medical experts that has been helping to oversee AstraZeneca US trial, had expressed concern that AstraZeneca may have included outdated information from that trial, which may have provided an incomplete view of the efficacy data. And there were concerns about thromboembolic or blood clots. And so we need a lot of explanation on this. Europe resumes use of AstraZeneca. The European Medicines Agency review came to the firm conclusion vaccine was safe and effective, and surveillance is ongoing. France, Italy, Germany, Spain restarted giving this vaccine. And Sweden, Denmark, and Norway have not resumed the use. So there may be some politics, and we'll see in the next week. Each day makes a difference. And but the most common is going to be one shot, which will be Johnson and Johnson. I think is very cheap to produce, and they can have they can meet the needs in a hurry. So this is in Texas A&M College, you know, the COVID-19 and PET study. It's a CDC-based supported researcher test PETs of people which are recently diagnosed with COVID-19. So B117 identified in black lab, mixed dog, and domestic short-haired cat, and both were asymptomatic. But the genome, you know, variability or genome test on them, which will show that PET isolates match the isolate from the owner. So the owner had it, is the virus transmitted, and whether, I don't think they have a reservoir there, but if they can spread from animals to men, there was no study as such, but spread was men to men. But common sense is if an animal is infected and had symptoms, then you've got to worry. A word on the cruise industry update. Previously, I presented several weeks ago when there were outbreaks on the cruise line, and all the passengers, majority of them tested positive or became very sick. And CDC recommends that all people avoid travel on cruise ships. So it's still the recommendation, same. Royal Caribbean planning cruises to Bahamas and Mexico in June. So in a couple of months. And the CEO says that vaccines are clearly game changer. So that's the current status. This is the Treatment Infectious Diseases Society guidelines. I just put this slide that you may or may not encounter that, but it's good to know that what works and what doesn't work. And these are, you know, tocilizumab, which is used in the hospitalized patient and who are sick and very progressive, severe or critical disease. It is used for that. Ivermectin, it has no place except in clinical trials, so it's not used. Bamlanivimab and itesvimab, they should be used for outpatient with mild to moderate risk of progression. And data was limited on siricimab and imidivimab. These are monoclonal, antibodies, and there is not enough data on that. So that's it. It's nothing to remember, but if your doctor, you happen to get COVID and they give you one of these medicines, so it's a good reference to fall back. Can a COVID-19 vaccine make me sick with COVID-19? No, it doesn't, because it's not a live virus. So the either DNA or modified virus is injected, which creates a antigen antibody reaction in the body. And when the real virus attacks, that it confronts it and suppresses it. So none of the COVID-19 vaccine contain the live virus that causes COVID. So COVID-19 vaccine cannot make anyone sick with the infection. People have allergic reactions, so that's possible. And COVID-19 and vaccine in children, I looked it up in CDC, and these are the recommendation. Children under 12 who get COVID-19 do tend to have mild illness or no symptoms. So either they have mild symptoms or they may not have any symptoms. So teenagers seem to have responses somewhere between what adults and younger kids have experienced. So your 5 to 12, 5 to 11, different age group than 13 to 18. And I think the vaccines are available for 17 and above. So I think this is the current recommendation. And for what reason younger children do not get the severe disease, we don't know. But on the other hand, in the United States, I think 262 children have died, but they may or may not have other conditions. So respiratory diseases or other ailments that made them sicker than the other group as well. So if the children have symptoms, you isolate them and you put in quarantine and get them checked with the virus test. If they're negative, have no symptoms, they are fine. And if they can tolerate the mask, is good idea, but sometimes they cannot tolerate, their risk is so small, so they can roam around, but not with knowingly with the sick people. They should keep their distance, and they should also wash their hands. So here is a little bit more studied group now, because we are into the disease for longer period of time, and they don't know what to call it yet. It's called long COVID or lingering on or chronic or post-COVID illness. And there was a study, 82% in both vaccinated and unvaccinated group had over one persistent symptom at 8 months follow-up. So that's the definition of long COVID. So there it has, after the infection, 8 months follow-up showed up that more than half had fatigue, and about half of them had shortness of breath on exercise or walking or at rest. And 1/3 or so had complaints of falling asleep. So patients who were in vaccinated group were older and had more comorbidities, other illnesses. And this is the lump sum of long COVID symptoms. They are tired, short of breath. They may have cough and joint pain, chest pain, depression, headache, and muscle pain. And most recently, they have said that they've seen acute psychosis. So, and there was one report of suicide. And now, what other factors were involved, we don't know, but they may have 4 or 5 of these symptoms. They may have it all, but they may have just few. But be on the lookout for this. And if it is present, you need some medical attention. And this will be studied in the coming weeks, and there will be more papers coming out on that. Receipt of Pfizer or AstraZeneca vaccine too was not associated in worsening of symptoms or quality of life in patients with long COVID. So the vaccine didn't, made it worse. And long COVID patients who had received the vaccine reported overall improvement in symptoms, and they matched with the unvaccinated controls. And so long COVID patients should be vaccinated if they did not receive before. So if they had an infection in the past and now they're in the category of long COVID symptoms, if they have a chance to get the vaccine, it's a good idea. Increasing physical distancing requirements from 3 feet to 6 feet in schools is not associated with a reduction in COVID-19 cases among students or staff, provided other mitigation measures such as universal masking are implemented. So whether they're 3 feet or 6 feet, it didn't make any difference in this study. And so I think the masking is much better. Here are variants in USA as of March 24th. And first one is B117, UK and Europe. Now we have in 51 territories about 7,500 cases. And B1351, South Africa, 219 cases, 27 location. And P1 is Brazil, and 61. When we started this, there were like 2. Now 61 US cases with the 18 states. It was only in 1 state at that time. So these people have no history of traveling, but the virus has changed and these are variants. Now, does the Moderna or Pfizer vaccine help you or protect you against these viruses, which are variants? The studies have not confirmed that, but they think it protects. But on the other hand, there is no confirmatory research on the variants. And they did a couple of studies with Moderna, and there was no conclusion. And this is a little complex slides. It shows B1429 in the orange, and the yellow is B117, all different variants. And here you see P1, the Brazilian. So these are percentages, so there are all variants. These are all different numbers. They're just variants. And every day there's something new pops up. And this is in India, a new double mutant variant of coronavirus, and 771 others have been detected in samples collected from 18 states across India. So they have another surge now with this, and they think it is more severe infection. And as we are approaching control here, and by end of May or beginning of June, uh, everyone should have access to the vaccine. We don't know how much variance is going to be in the air. So these are on Q home COVID-19 test is available, molecular test authorized for at-home use, and I'd say nares and nasal passages and throat, and over the counter, but you need a prescription for that. In about 20 minutes, it will show up. There are these boxes, and so you have to put this little stick in there, and this is disposable. It becomes medical, biomedical hazard material. You have to put it back in there and dispose it off. 96 to 100% sensitive, so whether you have symptoms or no symptoms, but if someone wants to quickly check it, it's give you peace of mind. And these are how many doses are being administered each day. Interesting, 2.57 million doses administered per day. It's a 7-day average. So it's going up. You can see that from January when the vaccine came, and every day is up and up. There was a little lull period, low period. I don't know what, end of February, maybe people were walking or, going on vacations and things like that, or could have been a problem with the efficacy of the vaccines, but then it was more available, distributed, and there was maybe distribution problem as well. But look at this. So we need 4 or 5 million a day, and I think the companies are making it, and Johnson and Johnson have in mind over a million, doses available pretty soon per day. So we should meet the requirements. Find COVID-19 vaccine near you. These are, vaccinefinder.org. And so this is one website. The other one is CDC. They have a list of retail pharmacy program websites. I think CVS is advertising it, and you can register and get priority based on the distribution and availability. And you may contact the state health department or local news outlets. So how to get the vaccine, but it's coming. This is, once again, I have shown this before, VSafe. Use your smartphone to tell CDC about any side effects after getting COVID-19 vaccine. You will also get reminders if you need a second vaccine dose. So this is a good website. I think pretty good. Didn't take that long, huh? It's sweet and good. Let's go to any question.
This seems to be getting more confusing as we go with all these variants, because we don't even know really at this point how long we're okay for after we get the shots for the initial COVID.
This is, look at this slide. This is confusing to me.
Oh
And
my God.
it's a week ending bi-weekly data. And you can see that, you know, the types, is a, the variants are named with the numbers because there are so many. And so here at the bottom is the most common. And look at this on February 13th to 27th, in 14 days, the spread on B117 or the week before was just a hairline, and then it got much more numbers, you know, just like that, the percentage wise. So uh, what stops it? I think the prevention, which we're already practicing, that is helping. And but these numbers have increased, but not as much as the main COVID-19 or CV2 virus. So I think we should take precaution, avoid going in public places, especially if you don't know if anyone had or has current infection. But if you know the crowd and they're vaccinated, you can go. I think it's going to turn to normal after June, when a lot of people will be vaccinated, unless the variants get a hold on these new people or the vaccinated people. But definitely, if you're vaccinated, it's going to be milder infection. It's like children, you know, you get milder infection. So, so it's not going to be that desperate, you know. But look at this in India, what happened. They got a surge and they're double mutants. They have two proteins, you know, on the cells instead of one. But, you know, the diagnostic is coming, vaccines are coming. So early diagnosis, early treatment, and we got very effective medications. So I think we have a good, you know, prospect.
The category for me opened up on Tuesday and I got the call. I'm getting my first shot of Moderna on Friday. And then they have me scheduled for April the 30th for the second dose of the Moderna.
Yeah, yeah, I think that's a good thing. You know, I'm so glad that it's available to more freely. And so I think I had no reaction, but one of our, I think Cheryl had a reaction. And I hope she does well and get over that and get antibodies and will be fit to uh, go to work.
So
Oh,
is,
yeah.
go ahead.
She's not on tonight. Did she have a bad reaction, Julian?
No, she did have a reaction, but she had a medical emergency come up with that friend of hers. So
Oh.
she's not able, but she's gonna look at the slides, because she's also really interested. I believe she's the one that told me that Cambria schools sent a slip for parental consent for the students to receive vaccinations. Now, I don't know what age group. I did send a text message to Tim Raymond, who's the superintendent at the schools, but he hasn't gotten back to me. But is CDC saying give the students vaccinations or not, doctor?
Well, I haven't heard any vaccination under 17.
That's
At
what I
one
thought.
place they were saying 12 and over can get it, but it is not, I'm not sure about that. So I think if they do the school vaccination, it has to be 17 of age. It will be senior class or junior.
Linda, have you heard anything from your grandchildren? Linda's not going to talk to us. She's got
Oh, I haven't talked to them. I can ask them tomorrow morning,
Okay.
but not the
Yeah.
ones that are in the Cambria Friesland. Two of my college grandchildren have received at least one dosage. One has received both because she's a CNA. And then McKenna teaches in a lacrosse middle school for a field work through her classes at UW Lacrosse.
But these are adults, right?
Yes,
Okay.
they're over 18.
Yes. So the vaccine trials were above 17, so age of 17. So, but
Cheryl,
they're doing it on children, and it will come. It will come.
because Cheryl just sent me at 5:30 tonight that she sees that Cambria sent out a letter for the parents to sign up. Maybe it's just for the parents and not the students. That could be.
Yes, but still, if they have access and the vaccine is approved for children above 12, I think that will be the category 12 to 17.
Okay.
So
What-
you guys have to tell me, I mean, I can continue. I mean, there's still material coming out. It's not over. If you have time, I'll do it next Wednesday and for the next maybe 4 weeks or so. Is that?
I'm still interested. I mean, I'd like to know what's going on, and I trust your judgment and your advice and your expertise. You watch TV and, from turning a channel, you can get different information.
Yes, there's so many views on this, and I think you want the reliable source, which is CDC and research. And my slides are based on CDC and UCLA, infectious disease in London School of Tropical Medicine, where I went for studies. And they've been doing a lot of research in England. And some political reason, people sensationalize this. I don't think you want to follow that.
If you've got the time to do it, I enjoy listening to it.
I do too.
So do I.
Okay, I will continue and we'll present it next week. And I have to travel to New York sometime, but we have access to the proper computer.
One more instance, doctor, if people our age, who of course are over the age of 65 and have got their COVID vaccinations completed, and you've got one or two in your group, say you're gonna get together with a group of 8 people, and there's 1 or 2 people that have not gotten their vaccination, the other 6 have, and they're 2 weeks beyond their final vaccination. Is it proper that just the people that did not get the COVID vaccination wear the mask, or is it proper that all people wear the mask, or what?
This is a very good question. Depends if the people who didn't vaccinate it have symptoms or no symptoms.
Well, they're going to tell you they don't have symptoms because they want to get together with you.
Yeah, if they have no symptoms, they should wear a mask. And if they have symptoms, they should keep the distance as well.
And stay home.
Stay home is the best.
Thank you.
You can send the pie to their house.
Hey, Penny just bought a pie of mine for $110. There you go. A lemon meringue pie went for $110 last Saturday night.
Wow, wow.
You were in the wrong business all these years.
Yeah, I
Joy.
should have been making pies.
You should have been baking pie.
Okay, that's wonderful. That's wonderful.
Hmm.
So, okay, I will be presenting it next week, right?
All
Sounds
right,
good.
thank you much.
Thank
Good.
you.
Thanks.
Thank you so much being here. So appreciate it.
Appreciate you.
Okay. Okay, Joanne.